explain, but do that or go to the SUA site, HCAA.org, and you can join. I would also make just one caveat, the recent SUA mini briefing that was sent out that regarding Insure Prize, I would encourage you to kind of not take that too seriously. I think you'll get better information here from Gary Nowickas, who is also a retiree from Harper and an insurance broker, than you would from Insure Prize. They have some very inaccurate information there. I did go through the site, so I'm not recommending it. Huh?
Is that what you're talking about?
Yes.
Which one is that, Liz?
You printed it out?
Oh, yeah, that.
Where was that, on this website?
Yeah, it was from SUA. It was from Linda Brookhart. And she, it hasn't been taken down from the SUA website. Bonnie said there was an emergency meeting of the board yesterday. After that came through, you may have, it was like a mini briefing. You get those notices. You went to that site, and basically they're trying to sell you get out of SIP, or CMS, and go to traditional Medicare with supplemental things. Please, I ask you, of course, this is the second in the series of seminars we're having. The third one is going to be December 10th. That is going to be a CMS session. Sharon Martin and I attended one in Romeoville. If you go and look, there are a few. There's one in Chicago, the beginning of December. There's one down at Lincoln Way, which is in New Lenox, Illinois, which isn't too far out of our sphere. There's one going to be in DeKalb if you're out that way. I would encourage you to attend one of those. They're well done. They do have vendors. They have the vendors of the different plans there, and you may speak with them. You may ask questions. And of course, we're going to have the session here on December 10th. I would also encourage you, when you get that form, all of you have gotten your application, it takes 66 cents to mail that in. Don't ask, but that's a piece of information I gleaned. So, and you shouldn't have to do a return receipt on it unless you mail it pretty late in the game. Remember, you have to indicate what you want to do. There is no default. If you fail to get your application in, you are out of the SIP program completely. So it's very important that, please, they're asking also that you make sure to contact anybody you know who might be, less than able to keep up with this, may not be technically connected. Well, they should be getting regular mail, but anybody who may be out of the country or out of town, it's very important that folks at least can make the decision that is best for them. Let's see, anything else I wanted to say? I would encourage you to go to the CMS meeting. CMS is going to do their seminar. It's going to be posted on their website. So it'll be online if you can't get to one of the sessions in person. So you'll get all the information there. I know everybody has questions. Yes?
Is there a difference between the college insurance program and the TRS one?
Yes.
Because I've been getting some information from friends in NAP program.
Yes. TRS is different than SIP. Not much. Actually, all state employees Medicare eligibility will be going into these, have the same choices, depending on where you live, of course. The judges, the legislators, all state employees, all of us have the same choices. How much you pay for the premiums and deductibles and things can be a little different. But, TRIP is a little bit different than SIP. So make sure you're looking at SIP. If you go to CMS, the Central Management Services, sorry, the state of Illinois, make sure it's state of Illinois, not the federal one. And then they'll have the programs there. And so definitely, if you're out of the community colleges, you're in SIP. 4 years too. Okay, I'm going to give a couple of our members some brief time here, and then we're going to go right with Mr. Nowickas. Okay, Betty first.
Okay, for those of you who believe that democracy works best when the two parties are represented, I have a petition, several petitions in fact, for the 6th Congressional District. If you're not sure if you're in the 6th Congressional District, I have a map of our gerrymandered district, which goes, well, that little chartreuse is Palatine, and it goes up into Lake County and over into McHenry and out a little bit through Elgin to Kane County and back down through DuPage. And the candidate that has agreed to run against the incumbent Peter Rostam in the 6th Congressional District, the candidate is from Naperville, Illinois. So I urge you, first of all, if you're inclined to want to sign a petition to get somebody on the ballot, to check carefully this, and if you know where you live, I'm sure you might be able to tell from this map, which admittedly is not very big or detailed. I'm going to sit in the middle of the room, and I'm not going to pass this around. Do you think that's too distracting from Mr. Nowickas' presentation?
A little later,
But people can come to me in the middle of the room and ask to check for sure whether or not you're in the 6th Congressional District. I know we're all confused because what used to be the 8th Congressional District was then the 10th Congressional District and is now the 6th Congressional District.
I was in the 8th, so I went in the 6th.
I've been in and out of the 8th a number of times. And
My daughter lives in Geneva, Illinois, and she's also in the 6th District.
Well, I'm going to cut you both off in
Okay.
the interest of time.
all right,
We have a-
so
we have
if
a
you're
lot of people-
interested in making democracy work with a two-party system, please come and see me.
Thanks, Betty. I'm Jean Pankinen. I'm the social chair for the HCAA board, and the people who've been speaking today are also on your board. We're all volunteers. We would like you to volunteer. In fact, to that end, in February, our board meeting is going to be open, and we just hope that you'll come and join us, see what it's like, and have lunch with us and so on. More information on that and other events will be in your upcoming newsletter. I have the only one right now. This is for December and January events. Let me tell you that on December 10th, you probably already know that CMS will be doing 2 seminars at Harper College. I'm really proud of that ours is the only community college association that got CMS to host on our campus. So well done for our association. After all this is over with, please join us for a concert on December 15th. We are going to subsidize the tickets by $2 and also have a free reception for you. So we hope you'll come on out and celebrate that all this insurance stuff will be over with by then. You may have noticed that the October insurance seminar, we did post on YouTube, thanks to Marlene Foley, I think.
Marlene Foley.
I think she videoed that, and that was her grandson's expertise who got that on YouTube. So today we're going to rely on me. I'm going to be videotaping Gary's seminar, and it takes a little time to get it up on YouTube, but please share that. We'll get it up there for you. I'm really pleased that Gary Nowickas is with us today. Gary responded to many of our requests for, sorry, Bruce? Oh yeah, yeah. Bruce and Hazel are volunteers who work on the membership committee. If we happen to have anyone here today who is not yet a member of HCAA.
That's why we're here. How many of you are members? If you would raise your hand. Okay, if you're not, Hazel Rilke, most of you, that's great. Hazel Rilke's in the back of the room. We do have applications. It's well worth the $36 that it costs per year because of the social events that Jean and Diane plan. because of seminars like this, I mean, you really get your money's worth, especially now with such critical things going on with our pensions and the insurance. So please see Hazel.
Is HCAA, if we belong to that, is that the same thing?
Yes.
Okay.
Your membership to one means you're a member of the other, and the $36 covers both memberships. Good question. Anybody who didn't sign the sign-in sheet? Okay. I'll start it here. So
Anyone
again,
who needs a seat, there are a couple
yeah,
of
there's a couple
nice
seats
seats
here,
right
and
up
there's seats over
front.
there.
Diane Kinn is also circulating a sign-in list today. Please be sure you.
Yeah, that's the one.
And I
That's
have
the
one
one.
too.
Thank
If
you
anyone
very
wants to talk about it, we privately at another time, so.
Pat, something
That's-
free?
Not right now.
So again, see Hazel, if you're not a member, we'd love to have you join us.
Oh, I was going to? Okay. Gary is a really special gentleman who has been helping our board to stay abreast of all this complicated information. As you know, the prior seminar was mainly on Medicare Advantage. The next one will be on the state programs. Gary is in the middle of those. He is mainly going to talk about Medicare and supplement programs today, so let's try to keep him on track. I know there's a lot of other questions. Gary is a special individual because he has 40 years of experience in this insurance field, is currently a broker whose contact information I put in that last newsletter if you want to track him down later. And he is also unique in that he's a CSRS member. So we're very grateful to Gary for being here today. Thank you.
Thank you very much, and my thanks to the board. They've been wonderful and grateful, and my thanks to all of you. I'm honored to speak to you tonight. I'm one of you folks, you're one of my folks. My name is Gary Nowickas. My wife Ellen and good friends back there, Betsy Levinson, worked at the Northeast Center for a number of years to our departure at the end of 2012. When I saw this information as an annuitant and also an insurance broker myself, I said, wow, to just let this go without at least sharing some of my knowledge with members, at least of our college here at Harper, retirees, not so good. So after discussing the matters with the board, we decided, Gary will talk to you tonight about the alternative to the Medicare Advantage. I might add, as a disclaimer, I am not allowed, as a licensed agent, to discuss MA with you tonight. That's by federal law. I regret it, but since I'm not a certified employee, I'm not a CMS employee, we'll try to keep your questions and try to keep the knowledge evolving around the traditional Medicare supplements. I've got to believe there are many of you in here that know what Medicare supplements are the kind, can you raise your hand if you have some idea? You don't? Oh, okay, see, there you go. Right now we are. Medicare subs have been around about as long as Medicare has been around, since 1965. Early on, they were varied in many ways that made it uncomfortable for purchasers. Some of them offered prescription drugs, some didn't. Some of the plans were actually different in different parts of the states in which they were provided. It was very confusing. So finally the feds decided, as early as 1990, listen, we need to uniform these. The whole idea of the supplements or Medigap plans is to simply fill the gap between what Medicare allows as a charge and what the law allows to be paid. And since Medicare started, usually it's 80% of what the allowance is, and there would be some deductibles depending upon what the charge was. Deductibles for hospital and nursing home facilitation, and deductibles for physicians and outpatient services and medical equipment. So the idea was, well, perhaps the private insurance industry can offer some type of programs to fill the gaps that Medicare doesn't pay for, because it might be difficult for many of our citizens to be able to afford those gaps. But as I mentioned early on, there was a great deal of varieties, to the point that in '90 the federal government said, whoa, we need to bring this in. We need to narrow it to so many plans so that And we need to do it on a national basis, not just a state basis, in order to help our citizenry make better choices for themselves, to help them understand more readily what's available to them. And then since then, they've dropped some of the, and they decided to go with alphabet letters, as most of you know. Why they decided certain plans would have certain letters over others, F being probably the most prominently known since all this began, I don't have the answer to that. But they said, you know, if we just stick with the alphabet, it'll be the easiest for folks to remember, and we'll design them accordingly so it'll make it easier for them to see that the more coverage we give them, the more expensive it might be, but you don't have to take this plan, you might want to take another. Then, as time went on, and I'm giving you this history so you guys have an idea what goes on. We'll get into the teeth of these a little bit more. Then they decided that maybe some of the plans that we originally put together by alphabet weren't worth it. And in 2010, they dumped a series out, E, I, J. I won't go into the details. And of course, January 1 of 2006, whatever plans may have had some outpatient prescription drug coverage still available, they said, no, no more. We have a new area of Medicare called Part D. So we're going to eliminate prescription drug as one of the prime coverages under these Medigaps or Medicare supplement plans. They are underwritten and structured, pardon my back, to fit just like a glove. They're there to fit the gaps. They are not fancy. They do have deductibles, but the idea with most of them is to pay for those deductibles. They don't, for the most part, have co-pays. They keep it simple for the, et cetera, et cetera. And the only requirement that they ask is that whatever provider you're working with accepts Medicare, and that you, as a Medicare enrollee, have Parts A and B. And from there on, it doesn't matter what part of the country you're in the United States, you've got, including Hawaii, et cetera, you should be covered without a problem if you need medical attention. Now, they also make available some of the letter plans, coverage for foreign travel. I don't want to get into that in too much depth, but please understand with that's a reimbursement. As you know, or if you don't know, when you leave the United States soil, you are not covered by Medicare. Some of the Medigap plans have some coverage, but here's the trick with those. They offer those on a reimbursement basis. So if you're stuck back in Botswana in the jungle and you're unable to deal with your provider there, you're going to have to pay up front, or worse yet, if you are in a situation where you need to be medically evacuated to an area where you can be more appropriately cared for, that can be, particularly if you're airlifted, that can be very, very expensive. The point of all this is, and I don't want to get off on this tangent, but is if you travel abroad, please, and yes, our agency offers it, purchase an inexpensive international medical policy for yourself. I know some of these supplements, if you have them, again, has the travel rider to it. It's, believe me, the cost is very, very minimal for the coverage you would have. You don't leave home without your tickets. You don't leave home without, and this includes cruises. When you get in international waters, you're outside the domain of the United States. This is a side issue, but more and more of us seniors are traveling than ever before, and you need to know there is a difference if you're going to rely on that $50,000 coverage from the Medigap policy that you might own. Just wanted to bring that up. But more importantly on Medigap plans, and tonight we're just going to give you a generic overview so you have an idea. I mentioned that you need to have Parts A and B. Please know that the Medigap policies are indeed underwritten by private insurance companies, the most well-known in the area, of course, Illinois Blue Cross Blue Shield, but there are many, many others. If you have a Medicare Advantage plan, you can apply for a Medigap policy, but make sure you leave your Medicare Advantage plan before you enroll in Medigap.
Would you repeat that again?
Yes. If you have a Medicare Advantage plan, now you don't right now, you can apply for a Medigap policy. But make sure you leave the Medicare Advantage plan before your Medigap policy begins. I might add, I have handouts for you with all this. I didn't want to hand them out yet. It's like handing out the dessert before you've had your Brussels sprouts and liver for supper. I don't know how it is. It's, again, as I mentioned, you need to have Part A and Part B of Medicare to qualify for a Medigap plan. The other difference than SIP is that with a Medigap plan, in a husband and wife situation, are both on Medicare, she has her own plan, you have your own plan. With SIP and TRIP, if you wanted to add your spouse, there was an accommodation for that as a dependent unit, and then yourself as an insured. With any of the Medicare supplement or Medigap plans, you have your own, she has your own, has her own. Which brings me to another point in this instance right now. Maybe MA is better for her and she can go to that, and maybe a Medigap plan is better for you, and vice versa. Just another factor that you can consider in your decision. They're individually underwritten, and they're individually priced by gender, by zip code, and age. Usually annual age and some age bands of 5 years. Now I'm going to say you can buy a Medigap policy from any insurance company or any broker. Most of the plans, if not all of them, including Blue Cross Blue Shield, are purchased through insurance brokers like myself. We work with 7 or 8 out of our office, and in many instances, people will purchase from other carriers besides Big Blue because the other carrier will be far less expensive. The plans, and I will have a list of all the letter plans, what they cover in the handout, are all designed by the government. They're not any different if you buy one from Mutual of Omaha or American Continental than they are from Illinois Blue Cross Blue Shield. So there is some thinking that, hey, if I can get as good a pair of pants from Kohl's, why do I need to go to Bloomingdale's? So the thought is that sometimes the lesser expensive rates are just as useful as the more expensive one, except what has been an issue that we've been talking about, or you've been talking about a little bit, as this new insurance program from the state comes about, qualifying event status. And that can have a decision on what you buy or don't buy if you elect to go to the Medigap or Medicare supplement version as opposed to what the state is offering. And that's this. With Medicare or Medigap plans, there are instances where you can shop guaranteed issue without any concern for your health background. And I might add, when you are enrolled in a Medigap plan, there is no pre-existing limitation, no matter how many different vendors that you might select over a number of years. The law does not allow for any type of waiting period or any type of exclusion because of pre-existing conditions. So, when you're off qualifying event status, most of the vendors out there offering this service will underwrite. Doesn't mean that you can't qualify, but it does mean that if there is health issues with yourself or your spouse, it could cause a problem to enable you to be rejected as opposed to being accepted. Now, qualifying events typically are when you first turn 65, you're given 6 months from the month in which you turn 65 forward to enroll, provided you have Part B, because you need A and B again, if you recall, to qualify for these plans. Secondly, like I might add the situation with those of us at the Northeast Center when our jobs were disappeared at the end of 2012, you're in a group insurance plan. You're over 65, but the plan is going away and it's not going to be available. They give you 63 days. If you act within that period of time, you can purchase a Medigap plan of your choice, guaranteed issue. And the third is if you are in an MA plan and that MA plan explodes or implodes, you need to find something else, you decide to go back to Medicare, because remember, when you're with MA, you are not on Medicare. You can, again, within 63 days, and with evidence, that's another thing I shouldn't forget, both with group insurance and with the loss through a Medicare Advantage or whatever, with evidence or proof that you lost your plan through no fault of your own, be able to shop the marketplace for replacements under the Medicare supplement or Medigap framework guaranteed issue. Otherwise, most of the vendors out there who indeed offer it will underwrite. Doesn't mean you're going to be rejected, but it does mean that possibility is always there. And in particular, if you have a chronic ailment that needs routine management, where they know claim dollars are going to be funneled out over periods, it's going to be difficult to qualify. Now, there is one exception, and I know there are many of you in this room know what I'm going to say, or I think you do. Illinois Blue Cross Blue Shield. They have all are welcome all the time, which is a great relief to know, and that's all the plans as well. They don't underwrite. They have a guarantee issue. Pre-existing conditions are picked up because that's the law, and they are there for you at any time, at least as of now. And the difference is, however, is that their pricing is a little bit high. It's not stupendously high, but they're a little more expensive than the competition. Why? They take on all the risks. But many people don't mind that because they know the name is synonymous and will be, you know, accepted almost anywhere, not only in this state, but across the country. Also with Medigap plans, there's no network issue. Again, the only thing they require is that the providers accept Medicare assignment. And about 98%, and let me clarify something since Pat was talking earlier. In this state, or in this country, about 98 to 98.5 of all providers accept Medicare. They may do it grudgingly because the reimbursements continue to be smaller and smaller, but they do accept it. So I think that kind of explains the elasticity of having coverage through this particular framework. Now, the other thing is, there are a number of different plans. There are probably 4 that are the most popular in the alphabet list. Plan F would be number 1. The reason being is Plan F picks up the Part A deductible, which is again hospital and nursing home facilitation charges. And I think for 14, that's now $1,216. It's gone up a little bit over 13. It will also pick up the Part B deductible in total, which is physician's charges, outpatient facility charges, durable medical equipment costs, that nature. And that going into 2014 will be $147 a year, which isn't bad. And of course then it will also pick up the 20% co-insurance that Medicare doesn't pay. And with that, if you deal with a doctor that is, again, a provider who accepts Medicare, there is no balance bill. It'll go right up, et cetera, et cetera. You've got the 20% co-insurance paid, you have the deductibles paid. But there's variations that also make sense too. It's just that some of these variations aren't always available. Plan G, does anybody know what I'm talking about when I talk about Plan G? If you know? Okay. Plan G is from an economic position, I think, the best plan of all if you're going to go the Medigap route. Now, it does require you to be responsible for your Part B deductible, but it's $147 a year. And that's why when we gather people, we like to show them the pricing per year or per month differentiation between F and G, and I'll tell you, over the course of 12 months, there is substantial savings customarily between the two, way beyond the $147 that you will have to incur. They pay they'll cover the full deductible under A, they'll cover the 20% under A and B. You're just responsible for the $147. There are others too, but with G, and I might also plan N, I'll go into N a little bit more detail. The problem is, under circumstances like ours, where we're coming out of a plan already, in this case an employer group plan, so that's what SIP is, it's what we call a carve-out. Under guaranteed issue, the vendors, except Blue Cross Blue Shield, will not make G or N, and I know we didn't discuss N, available. They will F, K, L, and when I give you the handouts, you'll see, if you read them over carefully, what these various letters cover. They will not offer G or N on a guaranteed issue basis. If you go through underwriting with them, when you're coming out of a scenario like this, or when those of us who lost our group insurance last January, et cetera, G and N are accessible. But that's going into underwriting. Again, with the exception of Illinois Blue Cross Blue Shield. All are welcome all the time, all plans. And that's... I did skip something that's important, and I apologize. We were talking about the qualifying event status. We don't know yet. I don't know. Maybe Springfield has gotten it clear now. But to date, it's not been my understanding that we know yet finally whether this scenario coming around is considered eligible for qualifying status definition. I was on the phone yesterday with a senior marketing organization out of Columbia, Missouri. They're their national organization. We were chatting, both my employer and myself, with a contact there, and we said, the thought is that in a situation like that, in this, we're not losing something in a way, because, for example, we lost our group insurance when our Harper days came to an end in as of January 2013. That's gone. And at our ages, those of us who left, which we'll not get into, we had no choice unless we went to work full-time elsewhere, which we did, but to go to Medicare. This is a replacement. It's not like there's nothing going to be available. And that's the concern here that might negate the companies offering the qualifying event status. And that's a shame, because that's really limiting at least your option to shop. If that happens, we don't know that yet, but we're running out of time. We, our agency, through our contractual relationship with this organization, at least with 4 or 5 companies, we're going to check and see if they know the situation, whether or not they would be willing to offer guaranteed issue if you shopped within what period. And that's the other issue. We don't know what period. Period of what? February or what? We don't know that. And I will keep, if I find out anything, I'll let our folks here know, Pat, Gene, whatever, if we hear anything, if we could confirm anything from companies like Mutual of Omaha, Combined Insurance Company of America, Warren Buffett Company out of Omaha, Nebraska, that you may not be familiar with, CSI, and perhaps even United Healthcare / ARC. Wouldn't that be interesting? But again, that remains to be seen. And that's a concern, and I can't tell you more than that. I don't want to comment or criticize anyone. It's just at this time, we still do not know if that particular function or feature, is available. Let's see where we're at here. So I've got so much here. Please bear with me. And I do want to get to questions, and I thank you for your patience. You all have this at home.
Yeah.
Should refer to it now and then. I know it's not exactly the most exciting reading, but it fills you in more on the Medigaps and the Medicare supplements. They are a very simple process, but it is important to note, though, when you go on them as well, certain of your other coverages will not be included in the package arrangement. Your dental will not be there. things become à la carte. More important than dental is your prescription drug feature. Admittedly, that's included in this package that CMS is offering going forward. That's a big thing. I appreciate for many that's a very major consideration. But you can move on to Part D in Medicare. It's not the easiest to track, to find out where do I go to find out about what. But you know, it's whether you decide to stay with the state's offer or move out, it's still a very, I think, useful, how would I put this, arrangement to go through or function to go to see where and how much I might have to pay for the medications I take. I've got a little handout here that I'll give you now. It's just, it may be some of you, I hope some of you have already been, if somebody wants to pass these out, I don't know, or pass these back. This is just a brief guideline to Medicare.gov. If you go online to try to determine where you can find out about how you can get information about the prescription drugs that you have. I think we'll need to pass back more back here. Maybe one per couple if you can. This is just folks, this is just a brief guideline. If you go on to Medicare.gov, the links you need to follow to try to determine how can I find out about the Best Buy for my prescription drugs. And I might add, at the time you do this, please have your prescriptions handy or have the name of them written down. If you happen to know whether they're generic, brand, formulary, or formulary, that's also helpful as well. I might add, I don't know if anyone else has heard this, I've heard this by second mouth that OSCO has a particularly aggressive program going through myrx.com, or you might stop at an OSCO pharmacy. Certainly some of the others are also very aggressive, particularly with generic medications, if that's what the bulk of your medicines are. When I say aggressive, that is refraining from any deductibles, in some instances co-pays, and that would be CVS, Target, Costco, and even Sam's. But this is something you will have to consider if you decide to go into the Medicare supplement area, which is, in my opinion, far broader as far as coverage goes anywhere and everywhere, as opposed to the MA. It is a nice package to have consolidated, there's no question, with the MA offer, but the Medicare Part D with the shrinking donut hole percentage continues to look more attractive, and in the next 2 or 3 years it's to disappear. Of course, if you were dealing with healthcare.gov like I am every other day, I wonder if everything's not going to disappear. I might also add, those of you who were here for the meeting a few weeks ago, the young lady, Allison Stamp, from our community, who works at the Palatine Township Senior Citizens Council. She is not a vendor, she's not a broker, and by the way, we do not sell the Medicare Part D. The amount of training time and the dollars involved for us to get recertified every year by the companies. But she had put together a nice piece. I wish I had a copy of it. And if you're in the vicinity, they're over at 505 South Quentin Road. Allison is, it looks like she'd be very, very helpful in trying to see if she could hook you up with a Part D plan that would try to keep your dollars down to a minimum, if at all possible. Let's see.
So these are